had a stroke, and since then I've been on 4 different medications.
My cholesterol, my A1C, my blood sugar, fasting blood sugar, and during the day, they were high.
I was tired all the time, didn't have a lot of energy, and
it seemed like there was nothing that I could really do to get those under control.
Between May and August, I've been able to lose 50 pounds.
Actually see improvement.
It's been able to help me reclaim my life, basically.
Well, you just heard it right there. Both of those gentlemen mentioned something that revolves around the heart, a stroke and high cholesterol. And since February is Heart Healthy Month, we want to help you become heart healthy. And joining us to tell us a little bit more, Dr. Jacob Torres from the Institute for Functional Health. It's good to see you.
Great to see you, and happy Heart Health Month.
Thank you.
Yes.
Thank you. The heart is a very important organ,
right.
and you've got something brand new at your offices that's really going to help us understand our heart and make sure it's working at its best that it can.
Yes, for sure. You know, so we're one of a few clinics in San Antonio now that are administering the Boston Heart Test, which is a very intriguing test because the heart, just as you mentioned, it's heart disease today in America, and has been for the last few decades, is still the #1 killer in America. So it's taking the lives of Americans every day based off of course, many times lifestyle choices. But a lot of people don't understand that you can still have normal blood pressure, normal cholesterol, and still have a heart attack.
So, and that's the thing that's very scary because it is a very silent disease.
Right.
And I want to show you how the heart works because it's an important organism.
Yes, for sure. You know, so if you look at the heart, you know, it's a muscle. It works as a double pump. So it's not only important that the blood flows through the heart into the lungs and back into the body, but the main thing I want people to look at in this picture is that look at the many different structures that are associated with this. We have valves that are very important. We also have chambers. We have muscle, and we also have electricity that plays a significant role in the way our heart works. So what gets confusing from time to time for people that are at risk for heart disease is that heart disease is actually not really much of a description of how well the heart is working, but how our arteries and veins that are affecting our heart increasing our chances of heart attack and stroke. And that's the most important factor here because there's many different things that contribute to our heart disease risk. One of them is going to be our lifestyle. Of course, if you smoke, if you're overweight, you eat poorly, those are going to be certain things that we need to be able to change that will raise our chance of heart disease. We also have metabolic factors. We have cholesterol. We have diabetes. We also have inflammatory issues, and that's the scary one that a lot of people don't know about. And we also have the genetic factors, you know. And we all heard about the individual that ran the Rock and Roll Marathon about 3 years ago, ran the marathon and had a heart attack, you know. So it's factors like that that we need to know, and that's what this Boston Heart Test is testing now.
What's a good age for someone to come in and get this test?
I would say at the minimum at the age of 18 for sure, because heart disease affects people of all ages. And unfortunately, heart disease is affecting people at a younger age now than ever before because of our lifestyle choices, inflammatory issues, and environmental choices that we're making on a daily basis. So this is a very interesting pamphlet. So for people that get the Boston Heart Test actually
I come into the office, I say I want the Boston Heart Test, you run some tests, and then I get this personalized printout?
Yes, it's a personalized printout that comes with about 27 pages worth of information that tells us, Shelly, here's what's going on with you. Here's the markers that we tested. Here's what we need to do to be able to change that. And the great thing about it is that it's covered by your health insurance.
Wow,
So it allows us to be able to do the assessment, the consultation, be able to see if this is a necessary test for you to get done, which if you are over the age of 40, if you are not as active as you should be, if you are, you know, smoking or drinking excessively, or have a lot of stress management is another major factor, then yes, we need to get this test done so that way we can prevent a cardiac event for you at some point in your lifetime.
Because sometimes you don't even feel it. You don't know it's coming. So it's important to have this test done. And I want to point out the numbers on your screen right there. A free consultation for the first 25 callers. The phone number is there on your screen. It's 468-1891. You can also text the word appointment to 44222 to schedule your consultation. And you mentioned this is covered by insurance.
Yes, it's covered by insurance, and the main thing is don't get caught off guard because you never know what's going to happen. And you know, you remember the Ice Bucket Challenge from last year?
Yeah.
We started our Do Your Part Challenge at the Institute for Functional Health. Part 1 is get informed. know what's going on, know what your risk factors are. Get two is going to get evaluated, so you can get well and eventually avoid heart disease. It's February. We know it's Valentine's Day, but let's take care of the most important organ in our body, which is our heart.
Absolutely, guys. And if you missed out on getting the new you started in January, this is the perfect opportunity for you to get started. That consultation is free to the first 25 callers, 468-1891. It's the Institute for Functional Health on St. Mary's. Their website is iffhealth.com. All right, still to come.